Anatomical positioning: posterior back of the body, interior front of the body, ventral abdominal, proximal at attachment, distal away from attachment, medial towards the center, and lateral away from the center. What are tissues? Tissues are cells that function as a unit. Types of tissues: connective, which binds, epithelial, which lines cavities, muscle, which has to do with movement, and nervous, which has to do with the nervous system. Muscles: skeletal muscle, which is bones, smooth muscle, which is in the digestive tract and has to do with blood vessels, and cardiac muscle. Extracellular matrix communicates with cells and is in all tissues and organs. Coxal has to do with ilium, ischium, and pubis. Vertebrae in order from top to bottom is cervical, thoracic, lumbar, sacrum, and coccyx. Skull's bones are mandible, maxilla, nasal, frontal, sphenoid, parental, temporal, occipital, and zygomatic process. Forensic anthropology is determining physical attributes looking at bones. The tools are calipers and protractor. The backbone of DNA is phosphate and deoxyribose sugar. Restriction enzymes come from bacteria and are named by genus and bacteria. The skeleton from top to bottom is skull, mandible, clavicle, scapula, which is the wing, humerus, radius outermost, ulna innermost, sternum, rib cage, pelvic girdle, femur, patella, fibula outermost, tibia innermost, tarsals, metatarsals, and phalanges. Agros is the electrophoresis gel. DNA differs person by person by base pairs. Cephalic is the head. Mental is the chin. PCR, polymerase chain reaction, makes copies of DNA. RFLP, restriction fragment length polymorphism, differs in DNA sequence recognized by enzymes. Ephysis is the end of the long bone. Diaphysis is the shaft of the long bone. Osteocyte is mature bone cells. Osteoclasts have old bone formation. Osteoblasts have new bone formation. Calcium hormone is the parathyroid hormone. Commutant fracture is a bone shatter. Compression is the vertebrae fracture. Transverse is a fracture at the right angle. Oblique is broken at an angle. Green stick is not breaking in half and has to do with sudden force and is most common in children.